Everybody, welcome back. So I'm always answering questions and then I put them in video form, and one of the questions that we actually get a lot, this one isn't even necessarily that I got this today and I'm answering it, but we get it a couple times a week. Whenever somebody calls in as a new patient, they ask, do I have to get x-rays? Some people don't want x-rays. They're worried about radiation, which on that side, there's such a tiny, minuscule amount that it actually doesn't really lay over into anything. The benefit much outweighs the cost. And in terms of why we do x-rays, is that you can just tell a whole lot more. Whenever we're working on the spine, it's a complex area. I can go in and feel on somebody's spine for joint restriction. I can feel an area that's not moving well and be able to tell this area needs to be adjusted, but I still want to see underneath for a couple of reasons. One is there are sometimes some scary things underneath that we would not want to adjust. We have actually had a patient in our office that I went through an examination. He was having lower back pain, and I went ahead and checked everything out, actually did some x-rays on him, and you could see that he had an abdominal aortic aneurysm, which basically means if I would have gone in and adjusted him, or even if he would have had a fall walking around, it could have burst and he would have been dead, bled out internally within seconds. Pretty scary thing that I wouldn't have seen unless I did an x-ray. So that's one reason, is to rule out scary precautions like that or tumors. We've actually even had, I remember a case, my father examined somebody and saw a tumor on their spine and sent them out, and they had surgery within that week. The guy that I sent out had surgery that day. So we want to make sure that there's nothing crazy underneath, but even on top of that is we can get more specific in our treatment. So whenever we're dealing with the movement of the spine, all the bones that stack on top of each other should move a certain way. So for an example, with the lower back, this is looking at a normal back straight through. The legs are level, the hips are level, and then they're all stacked up straight. These lines in the center are the bumps that you would feel if you push on your back. These guys, that's what you would feel if you push on your back. Now, whenever you lean to the side, let's say I'm going to lean this way, those bones should move a certain way. So it should pinch here and gap there, pinch here, gap there, pinch here, gap there. So they all tilt like this, but they don't tilt straight over. They should also turn inwards. So these lines should look like they're further to the inside of the curve, and that looks like this. So pinch and gap, pinch and gap, pinch and gap, and then all these lines are turned over to the side. Simple little bitty things where maybe this area feels restricted, but this one's not rotating at all, and that one is rotating. And then this one's not tilting, but that one is. Those little bitty things that we can see on the x-rays help us refine what we're doing during our adjustment to be more specific, to get better results, which is always our goal. We want to be able to be as accurate as possible, go in more like a sniper, not a shotgun. Try and actually get specific on what we're doing. That's why we take x-rays. That's why we consider it very important, and that's why a lot of times whenever a patient calls in and they're like, I really don't want to take x-rays, it's just our policy here. Knowing what we can do more specifically for better results, but also directly have seen cases where if I would have just go in and adjust and then that person dies, I would never ever forgive myself, and so we hold ourselves to a little bit of a higher standard. If you guys have any other questions, please always reach out. If you found this interesting, I can give a thumbs up. If you think somebody else needs to see it, go ahead and share, and you'll have a great day. All right, bye.